Hello everyone, welcome back. Today I'll be covering regarding topic hypoparathyroidism. In this video, I will define the hypoparathyroidism, overview regarding hypoparathyroidism, pathophysiology, the causes or etiology of hypoparathyroidism include postoperative hypoparathyroidism and investigation for hypocalcaemia. Definition: hypoparathyroidism is a hormonal disorder occurring due to absent or inappropriately low levels of parathyroid hormone (PTH) in the circulation. It results in low calcium levels and high phosphate levels. Overview of hypoparathyroidism. The parathyroid hormone, vitamin D, and calcium regulate the calcium homeostasis. Hence, the decreased calcium levels in the body fluids leads to the signs of tetany. Laryngeal muscles are the most sensitive muscles to tetanic spasm. Tetanic spasm of laryngeal muscles obstruct the respiration that usually cause death due to inappropriate treatment. This figure illustrates the thyroid and the depleted parathyroid hormone whereby the organ become shrunken. Regarding pathophysiology of hypoparathyroidism, it started off at the parathyroid gland itself that unable to excrete the parathyroid hormone. Then an action in the bone is there is reduced resorption and increased formation in the bone, whereby the serum calcium level will be low or drop. Parathyroid hormone also stimulate the kidney to change from the inactive form to active form that will stimulate the gut for GI tract absorption for the calcium. When it's not present, the calcium level will be dropped. And with the low calcium level, there's also an increase in infiltration, reduced reabsorption at the nephron region, whereby there will be an increase in the calcium excretion. Remember, the pathophysiology is due to the etiological cause that will decrease in the gland function. There will be resistance to parathyroid hormone action and inadequate parathyroid hormone secretion and increased reabsorption of calcium in the GI tract, whereby the blood calcium will fall to the low level and muscular hyperirritability will occur and patient will present with uncontrolled spasm, hypocalcemic tetany. Postoperative hypoparathyroidism. The most common acquired cause for hypoparathyroidism in adults is postoperative hypoparathyroidism. Surgery on the thyroid or parathyroid gland or adjacent neck structures or neck dissection surgery for malignancy may lead to acute or chronic hypoparathyroidism. Postoperative hypoparathyroidism is due to unavoidable removal of or damage to the parathyroid glands and or their blood supply. The diagnosis of chronic hypoparathyroidism requires that features of hypoparathyroidism persist for at least 6 months after surgery. Postoperative hypothyroidism after thyroid surgeries appears in around 32.8% of cases in the series reported by Di Carlucci et al. 2008. Transient hypothyroidism incidence has been estimated to range from 6.9 to 46% by all the others example et al. 1988, Morse et al. 2014. Permanent hypothyroidism from 0.4% to 33%, studies by Etty et al. 1979, Minger et al. 1986, and Fogg et al. 1988. Autoimmune hypoparathyroidism. After postoperative hypoparathyroidism, autoimmune hypoparathyroidism is the next most common form of hypoparathyroidism in adults. Autoimmune hypoparathyroidism may be isolated or part of an autoimmune polyglandular syndrome (APS). Other causes of hypoparathyroidism include genetic defects due to mutation of genus locus on chromosome 20q13.3. Solitary endocrinopathy referred to as isolated hypoparathyroidism. PTH gene mutation, X-linked hypoparathyroidism. Hypoparathyroidism with additional features include A. Polyglandular autoimmune hypoparathyroidism, D. Josh syndrome, C. Hypoparathyroidism retardation dysmorphism syndrome, and D. Hypoparathyroidism deafness renal dysplastic syndrome.
Now let's get into the investigation of hypocalcaemia. Before we confirm it is hypocalcaemia, please repeat the measurement plus or minus ionized calcium level. So the investigation that others include serum magnesium, the parathyroid hormone, and assess the vitamin D status with 25-dehydroxy vitamin D measurement. For serum magnesium, if it's low, we need to evaluate for the etiologies of hypomagnesemia. These include gastrointestinal losses, either due to vomiting, diarrhea, malabsorption, the presence of renal wasting, alcoholism, malnutrition, drug-induced. Perform a 24 hours urine and further testing as appropriate. If the serum magnesium is normal, evaluate for hypoparathyroidism. Next, regarding the PTH level. If it's elevated, evaluate for etiologies of secondary hyperparathyroidism. These include malabsorption, vitamin D deficiency, pseudohypoparathyroidism type 1 and type 2, vitamin D dependent rickets type 1 and type 2. If the PTH level is low or inappropriately normal, evaluate for hypoparathyroidism. Lastly, regarding the vitamin D status with 25-dehydroxy vitamin D measurement. If the vitamin D sufficiency is confirmed, please evaluate for hypoparathyroidism. If vitamin D deficiency is confirmed, evaluate for gastrointestinal losses or low dietary intake, low sunlight exposure, and lastly, replete the vitamin D. It's on the right hand side. Okay? So, regarding evaluation for hypoparathyroidism in the middle, must start with complete medical history, family history, past surgical history for prior parathyroid, thyroid, or neck surgery. Physical examination includes any presence of neck scars, candidiasis, signs of tetany, cataracts, short stature, or mental retardation. The family history of mental retardation, features of autoimmune disorder, example Addison disease, autoimmune thyroid disease, deafness, renal anomalies, thalassemia, or iron overload. Further laboratory testing, genetic screening, and testing of family members as appropriate by activating CASR mutation, PTH mutation, GCMB, or GATA3 mutational analysis. Assessment of autoantibodies, 25-hydroxylase antibodies, antiparathyroid antibodies, hearing test, renal imaging as appropriate. Yay! We have reached to the end of this video. I hope you have learned something. See you in the next one. Take care and bye.